Hello, everyone. Welcome to this segment of Virtual Vitality Health Fair 2020. I'm going to discuss a topic many people are curious about, medical anxiety. Medical anxiety is really health anxiety, and health can mean different things to different people. For example, an extremely fit athlete might consider themselves to be unhealthy if they suffer an injury that prevents them from training. However, a person with a diagnosed condition such as diabetes or asthma might consider themselves healthy if they are managing their condition well. So, from time to time, we all worry about our loved ones, our jobs, our money, our definitely our health, and we might notice changes or different sensations in our bodies, and we might wonder whether we might have a serious medical condition, and especially now during this global pandemic. Yet there is a difference between general concerns about health, and which we all experience from time to time, and something that's more problematic, referred to as health or medical anxiety. Are you a person that finds yourself worrying a great deal about your health? And do you pay closer attention to sensations or changes in your body that others would simply just not pay attention to? Well, if your worry is excessive, that could be an indication that you have some health anxiety. If it's excessive, it will be out of proportion to what is real and what is really going on and that they can find evidence for. If it's persistent, despite all the negative tests, if it leads to unhelpful behaviors such as excessive checking and reassurance seeking, and if it causes you significant distress, it could impair your ability to go about your day-to-day life. Also, you might notice that it affects your relationships with your family and friends. Time spent worrying about your health or seeking help from professionals might impact your ability to socialize or attend important events, uh, work or study. Time might be taken up uh, by medical appointments or internet searching, and could lead you to falling behind on your work or study tasks. And in some cases, you might even become so focused on your health or your health concerns and seeking certainty about your health that you'll stop doing things that you used to enjoy or that gave you some sense of achievement. Repeated trips to the doctor without clear results can leave both you and your health provider feeling dissatisfied. You might even feel frustrated and angry towards your health provider or towards the health system entirely. Multiple trips and repeated trips to the medical appointments, when procedures, time spent away from work, and even travel costs to those appointments could soon add up. So when life events happen that are beyond our control, like the COVID-19 pandemic, anxiety is likely to rise. And what is the anxiety? Well, anxiety is a sense of loss of control. It's a feeling of lacking support and structure. And it's triggered by unresolved and avoided emotions from past traumas or current events such as COVID. What anxiety is not who you are. It's not something that's permanent. And it's not something that's wrong with you. Anxiety is something that's wrong with the way you're thinking and feeling about it. And it's located physically in the human body. For some people, anxiety can feel like a racing heart, uh, pressure, tightness, weight in your chest, shallow or shortness of breath, and muscle tension in various places of your body. And what happens when it's too high? Well, it can manifest in physical symptoms. You could have stomach aches or um, brain fog, or you could have difficulty with concentration. And it can trigger panic attacks or depression or PTSD. And what can you do about the anxiety? Again, the anxiety is not who you are. It's something that's happening to you, and anxiety can be alleviated. Mindfulness and coping skills can help. Medications can sometimes help. However, coping and medications do not get to the source of the problem and eventually do lose their effectiveness. So, specifically, avoidance of strong emotions has been found to trigger unconscious anxiety, which can be experienced in the form of physical symptoms. So, what do you do? The best way to reduce and alleviate your anxiety and their physical symptoms is to work with a licensed mental health professional. They can help you understand the source of your anxiety. And other interventions that have helped people are like gratitude journals, forgiveness coaching, letting go of anger, mindfulness exercises, and some degree of physical activity, exercise, trauma therapy, such as EMDR, and relaxing bedtime routines. When your high anxiety levels are alleviated, all of your severe and moderate symptoms will likely disappear or at least be greatly reduced. And professional counselors can help you to manage chronic health conditions and cope with stress. Um, but it's the client counselor relationship, the therapeutic bond, it's the most important element. The simple act of listening, taking you and your concerns seriously, and becoming your ally can jumpstart your healing process. Counselors can sit down and build a rapport with you and treat you with respect and dignity, and it will lead to helping you heal. Okay, so let's take a deep breath and let it out slowly. Once more, take a deep breath, hold it in, and let it out slowly. That's one of my favorite interventions for anxiety. If you can learn to do that on a regular basis, you'll always have a tool in your pocket to help you reduce your anxiety wherever you are, no matter who you're with and where you go. Thank you for listening today and joining me. Be well.